Hello and welcome back to the Patient First Podcast. I'm your host, Dr. Bryan Laskin. And oh man, I'm excited. I'm excited that you're here. I'm excited for our topic today. There's very few topics that I get as excited about as launching a brand new initiative. And today we're going to be talking about something that's really near and dear to my heart and really big, I believe, for our industry that's coming out. Now, I want to mention that over here at the Patient First Podcast, Tooth Apps Care, kind of this world over here on this side of the microphone, we're really focused on three major things. And I've talked about this on the podcast before: education, innovation, and standardization. A regular listener, you've heard me talk about standards and Odin and Thor and all the things that we're working on, from Dental Standards Institute with the American Dental Association, driving standards for interoperability, data accessibility, all of that. And obviously we talk a lot about innovation. We have people on the podcast talking about innovation all the time. Also, we create our own innovative platforms, Tooth Apps and Care, and we're trying to change the industry through making tools that are a joy to use. But today we're going to be talking about the next level of education that we have over here at the Patient First Podcast and what we're going to be talking about. And I couldn't be more excited. Now, I'm going to put this in the context of the last couple of years. Why? Because the last couple of years ago was a wake-up call, right? I wrote a book called The Patient First Manifesto. We created this podcast, the Patient First Podcast. And, we really look to challenge clinicians and especially dentists to reorient their practices around one undeniable truth: that the patient is the purpose, right? We are here to take care of patients, and patients have changed, right? There's this, what I call in the book, the great disconnect between dental professionals and dental patients. And, we are working hard on that every day when we're talking about putting the patients first. Obviously, it's the name of the podcast. And over the last 2 years since this book has come out, we've shifted mindsets, right? Not systems, but the minds of providers, urging people to break free from legacy thinking, rediscover the humanity in healthcare. And this book really kind of, I think, cracked the door open. Now you hear people talking about the patient experience and focusing on putting patients first. And I think we were helped driving that movement forward. And, I've talked about over here at Tooth Apps with connected dentistry recently. I've been talking a lot about how people are using the exact same verbiage that we even when we have a registered trademark on terms, people are using the terminology that we have. And it all started with this book, with the Patient First Manifesto. Now, I also want to mention that has continued. About 18 months later, came out with my second book called Dental Disorder. If the Patient First Manifesto was a wake-up call, dental disorder was the diagnosis, right? What I do, this is kind of a book where I call out what's going on in the industry, talking about the biggest problem in the industry, and the dental industry specifically. If the Patient First Manifesto was a call to arms and a wake-up call to focus on people, not, as them putting the humanity back in healthcare, dental disorder exposed systemic failures within dentistry that were quietly sabotaging care. Things that, we've been too busy to look past our loops to actually see: hidden incentives, fragmented data, and obsolete tools. And you've heard me talk over the last 18 months a lot about what we're doing over here and others are doing to try to bring together the fragmented data with interoperability, trying to get past the archaic technology that we have to deal with in dentistry, how to expose the hidden incentives and how to get beyond that so that you, dental professionals, DSOs, the people that deliver the care, should get paid, right? This book handled dentists the mirror to the industry. And, if you held it up long enough, you could see the industry's flaws without flinching, right? This is really an expose on the problems that I saw in the industry through developing technology and working with DSOs and others in the industry that I thought were going unexposed. But dental disorder made the problem visible, and the solutions were very actionable. That's why I called the book The Disorder. So first we had a wake-up call with the Patient First Manifesto. then the diagnosis of the problem with proposed solutions that frankly right now I'd say we're about 85% of the way with all of the solutions that we've called without in dental disorder. At the very beginning of this book, I mentioned I hope that this book becomes obsolete. And I do believe now that we are going to make this book obsolete, probably in the 18 to 36 month time frame. I think we will at least have the opportunity for you to plug in and solve every problem that's exposed in this book. If not all the problems, the vast majority of them. So we had the wake up call, we have the diagnosis, and my friends today, what I'm excited to present to you today is the third book in the series and likely the trilogy, which is The Revolution. It's called Unfair Care, the definitive guide to commanding your healthcare experience. Unfair care is the revolution. It doesn't ask for permission. It doesn't speak to the system. It's not trying to solve systemic problems. What it does is it speaks directly to the patient. This is the Patient First podcast. The first book was the Patient First Manifesto. This book is the guidebook for patients. It gives patients the tools to command their care, not request it, to demand their data, not beg for access. Data is the foundational element for taking care of yourself and your family members' care. It speaks how to understand the system, not by being victimized by it. Unfair care is the playbook for every person who's ever felt dismissed, overcharged, or trapped by a system that was supposed to protect them, but is designed to exploit them. So the healthcare system is not broken. It's working the way it's supposed to be designed to work. It's rigged. And what unfair care does is it gives you, as a healthcare patient, the tools and understanding to actually not be victimized by that system. So we give you, for example, let's talk about it. Obviously, maybe not obviously, but it does. It exposes the fact that oral health is the gateway to overall health. However, the healthcare system has excluded it completely. How do you, as a dental patient, command your own data? How do you connect your dental care and your medical care in a way that you can have whole body care? How do you select care team members? What questions do you ask them? How do you prepare for appointments, right? There's one common denominator between a patient's healthcare visits, and it is them. I believe strongly that patients need to be empowered to take care of their own health. Now, absolutely, they cannot do that alone. Expertise of clinicians is paramount, and relying on the expertise of clinicians is paramount. I mean, within the book, I talk about how this is where you cannot replace clinical. I don't care how many tools the patient has. You just can't replace a human clinician who has expertise. But those clinicians have to work together as a team to provide the best care. That's what we talk about. And how do we do that? How do you, as a patient, become the owner of your healthcare so you can pick the right quarterback and have all the right players on the field? So whereas the Patient First Manifesto opened our hearts to connecting directly with patients, and dental disorder opened our eyes to the biggest systemic problems in the dental industry, unfair care puts the power directly in our patients' hands. Every single one of my books were controversial, talking about patients, putting patients first. I got a lot of grief and a lot of compliments on that. With dental disorder, oh my gosh, a lot of blowback on the expose that I did in the industry, right? But now you're hearing people talk about interoperability. I believe, particularly with dental disorder, we started the conversation. I want to do the same thing with unfair care, and I want to hear your perspectives on it. Do you believe that patients should be empowered with their data? That they should become the quarterback of their own care, that they have responsibility in their care, and that giving them a guidebook on how to do that and what to do makes sense. Let me know. Now, this book comes out October 7th of this year. Very excited about it. The interior is being designed right now. So the book is completely written. You can go and you can pre-order it at unfaircare.com. And we have lots of special deals, and you'll get lots of freebies and things if you pre-order the book, and you'll get some stuff from yours truly. If you are a listener of the podcast, we're including some personalized items directly for you on if you pre-order the book. So go to unfaircare.com to pre-order it. I believe it is my best book to date for sure. Whereas the Patient First Manifesto really brought together some things that we did in our practice that I think really made our practice a top tier practice. And dental disorder laid the groundwork for what we're doing at Tooth Apps. I believe Unfair Care could ultimately be the most important thing, which is speaking directly to the people that actually have the problem, patients. How do you do something about it? And maybe it's, if you're thinking, which would be a very reasonable thought, did this come out of a personal experience? The answer is absolutely yes. Maybe I'll talk about it on another podcast, but there's something very personal that happened to somebody who's, as close as somebody can be to me, that sparked this book, the impetus, healthcare experience journey that I've been on for the last year, that I believe everybody has a story like that. And I wish that I had this book as I was going through that journey over the last 18 months. So hopefully you'll enjoy it. Hopefully you'll pre-order it. Go to unfaircare.com and you'll hear a lot more about what we're going to be talking about on this podcast to put patients first from this perspective. We're going to be bringing on physicians and patients and tools and talking directly about how in this new age of empowered patients, how do we deliver the best care? How do we grow our practices? Because I do believe, just like I felt when the Patient First Manifesto came out, that the best way to position your practice was to put patients first. If you read Unfair Care, it'll give you the perspective that I think patients are going to be more and more commanding. So I would just, if nothing else, just for your own edification and for positioning your practice for where patients are going, I believe this is the roadmap. So go to unfaircare.com. Comes out October 7th. Very excited and very excited to talk about this more on the podcast. So let me know your thoughts, and I look forward to seeing you right here next week on the Patient First podcast.